living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
Community health centers play an important role in Montana, Wyoming, and across the country. Their mission is to promote quality health care to everyone, especially those who are underinsured and medically underserved. On today's show, we'll learn about the history of community health centers, what they have to offer, and why they're important to our communities. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. I'm Sarah Medley, your host. Stay tuned. Welcome back to Healthy Living for Life. Before we start our show today, we're going to first play a short clip about the history of community health centers.
It all began 50 years ago as a modest social experiment during America's war on poverty. The goal? To bring doctors and primary and preventative health services into poor urban and rural communities, places where health needs were neglected and ignored by mainstream medicine. A revolutionary partnership was created, bringing together for the first time reform-minded physicians, nurses, local community leaders, and the federal government to build a new type of community-based health care. It would serve all people, no matter who they were, where they lived, regardless of income or insurance status. And it would empower and give voice to people living and working in those communities to direct how health care was to be delivered. That small investment 5 decades ago has saved countless lives and strengthened thousands of communities. Today, community health centers stand as the largest and most successful primary care system in America.
As you just heard, community health centers play a large role in providing health care in our country. Joining us today is Cindy Sturgar, the CEO of the Montana Primary Care Association. Thanks for joining us today, Cindy.
Thank you, Sarah. It's great to be here.
So let's start off talking about how many community health centers are in Montana.
So the community health centers, there's 17 organizations that have over 70 sites, so places that they deliver service in Montana.
So how many Montanans actually access community health centers, or CHCs as I call them?
Right, so we've been around in Montana for over 40 years, and last year in 2017, 107,000 people got their care through one of those sites in one of the community health centers in Montana. So about 1 in 10 people in Montana get their primary care with community health centers.
How does the Montana Primary Care Association relate to community health centers?
So just like other people have systems of care, or you have a teachers association, we have a primary care association. So we're the association for the state, and our members are the community health centers, and other people who might provide primary care are partners that we work with in the state. So we do a couple things with our members. We do a lot of training and technical assistance. We're always looking at how to improve access, how to improve quality, and how to improve operations. So that's a main tenet of what we do as a primary care association. And then the other side, of course, any of us in healthcare are looking at policy. So we're always looking at policies that impact vulnerable communities in Montana. So we're very concerned about insurance, we're concerned about coverage, we're concerned about access, right? If somebody lives far away, can they get somewhere? How do we make sure they get there for care?
I understand that you offer sliding scales for payment of services. Can you talk about that?
Right, so the community health centers in Montana are all independently owned, but there's over 9,000 organizations in the United States that are community health centers. And all of us have a sliding fee scale, because one of the barriers to care, one of the reasons people don't go to get care is that it may cost too much for them. So if they have no means of paying, it's really important that we say, we don't want that to stop you. We have a sliding fee. So based on your income, you will be charged accordingly. So we don't make that up. That comes from the federal government, and it's readjusted every year. But for example, if you're a person, one person, the minimum or the 100% of poverty in the United States is around $12,000. So if you make less than $12,000, you would probably have your bill slid to a very low cost in a community health center.
And so that would be $12,000 per year, right?
$12,000 per year. So many of us have lived at $12,000 or under per year in Montana, especially if you work part-time. Almost everyone we see works. It's just how much they're making and how big their family is. So that's a big tenet across the United States in every community health center.
Something that seems a little confusing to me is the terms community health center and critical access hospitals. So can you talk about the difference between those two entities?
Yeah, it is confusing, especially if you're in a community and you really don't care what the name is of something, right? But in essence, a critical access hospital is a hospital-based system that is based within patient care. They may do other things, but they start as being an inpatient care facility. And community health centers start with being an outpatient primary care center, and they do many things too. So their origins are different. They may oftentimes partner with each other, but they're very different as far as how they started.
The community health center, or CHCs as we're calling them, can they provide more affordable care than hospitals typically?
You know, that is a question I can't really answer because it really depends on the locality. But usually what happens is that inpatient care costs a lot more because it's 24/7. Outpatient care does not. So the goal in primary care is to try to keep a patient healthy and hopefully that they don't end up having to have inpatient care. Most of us don't like to go to hospitals, nothing about the hospitals, but most of us like to be healthy. So the whole goal in primary care is to keep you as healthy and functional for as long as you can be. So our goal is a bit different than an inpatient facility. So often, because of that, our costs are less. Overall, not for a specific visit, but overall, our cost to healthcare system is less.
Very good information for sure. We'll pause here for a short break and we'll continue this conversation after these messages. Stay tuned.